So mental health itself is a branch of science. I hope you are there. Branch of science introduction, I've already spoken that deals with the function of the brain and includes anatomy. I'm a psychiatrist by profession. Now, a psychiatrist is a medical doctor who has gone on to specialize in mental health. Whereas a psychologist does not have to be a medical doctor. That's the difference. Okay? Anybody can be a psychologist. But to be a psychiatrist, you must have medicine. You must study medicine. Why must you study medicine? Because the brain, a lot of the mental condition we are having is actually medical. It has a medical connotations. It's not just psychological. So there's the issue of the anatomy of the brain, the physiology, the biochemistry of the brain, and within the brain, we have the neurotransmitters, as well as behavior and personality, and psychiatric disorders. You can go to the next. I want to make it short. All right. In America, it is estimated, I wish I was seeing this thing. I can see what you meant. I can stand there.
Oh, yeah.
Where? Is there a screen?
No. Or you stand here, use this.
You can see. Yeah. So that we are in sync. Yeah, we are together. There are over 17 million adults in the United States, as you can see there. These figures that we are giving you just to tell you mental illness is not only in Africa, because in Africa, they think in terms of witchcraft. When it comes to mental illness, they think, iyo mpaka mtu amero. Sasa tunasema in America, nani anawaroga? The medicines we are using are made in America and in Europe. So this, to tell you, this is purely a medical condition and has nothing to do with alirogwa. The prevalence of major depressive disorders and so on, I don't want to read that. In Kenya, it is estimated that 1 in every 10 people suffer from a common mental disorder. So if you are 100 people, 10 people there will be having a mental disorder which they may not be aware of. Depression and anxiety disorders are leading, okay? And in 2017, who ranked us at number 6 for mental challenges, and 1.9 million Kenyans suffered from depression. Next. I'm rushing so that I know you're already hypoglycemic, you're nanja, nastaki muanguke kama vile nilianguka. So that's the brain. When we are talking of the mind, we are talking of the brain. You can see the huge part is where that's the forebrain, and at the center we have the midbrain, and behind we have the hindbrain. Now all these aspects of the brain, they do different things. But what is the emotions? The emotional aspect of the brain is done at the midbrain. You see there is something there called the thalamus and the hypothalamus. And the thing you see there like an umbrella is called a corpus callosum. That joins the two hemispheres of the brain. Now these frontal lobes, the ones which are housed here, they are involved in your personality. If there's a damage to those, say in an accident or infections, then a person changes his personality. The ones, the thalamus and the hypothalamus, they are portions of the brain that are involved in what you call the autonomic activities. Autonomic, these are activities that take place within you without your knowledge. For example, breathing. You are breathing and you don't know that you are breathing because there's an autonomic activity going on. Your emotions, your digestive system, all those internal systems, your heart rate, everything goes there. And the drugs that we are going to get for treating, say, emotional disorders also are in that area. Now, how does it work? The next slide shows you various neurotransmitters. Now, I keep on telling people that the brain is like a computer. If you understand the computer, you'll understand the brain. But you know, it's the brain that made the computer. So the brain is superior to the computer. And the person who was developing the computer was basically trying to develop a brain. And actually, a computer is a brain of its own. And now we have supercomputers which can do wonders. Now, within them, you have neurotransmitters. These neurotransmitters, if they are deranged due to any reason, you have a mental disorder. If they are high, you become hyperactive. If they are low, you become depressed. And the medicines that we are given for treatment either will help to elevate the levels of these neurotransmitters by blocking their destruction. You see, the nerve is like this electric wire. You see, there's a junction box where two wires meet. That junction box is called a synapse within the nervous system. And when there is a stimulation of an aspect of at the end of the nerve, that junction box releases neurotransmitters. It is these neurotransmitters, after being released, they have to be destroyed again by another enzyme so that they don't keep on stimulating. All right? So if they are low, we give you drugs which are going to block their destruction, therefore elevating the levels of the neurotransmitters in the junction box. You can see how closely correlated the brain, the computer, the electrical system, the wiring, basically is the same. Okay. You have also other minor neurotransmitters. We call them endorphins. Next slide. Endorphins, these are they are peptide hormones which the brain releases for your emotions. For example, when you have meetings like here, when you sing, when you dance, like David danced. You remember zamani, Anglican church, you could not even clap. Sijui kama mnajua. If you are old enough, you could not clap, you could not play a guitar. And then the new churches came, they started clapping, and that activity of celebration actually releases endorphins into your system. It is beneficial. As you come to worship, as you sing, as David did, as you dance, it releases these endorphins, and it should be encouraged. People who do exercises also, they have these peptides released. That's why we also encourage you to do exercises. When you do exercise, there's also increased production of endorphins, which are also important in your sexuality, in your life. You enjoy life. Those are various types of endorphins. There's no need of going into that. Now, our summary is that we are talking about the environment. This environment is the one which is going to affect your brain, the brain which we talked about. Now, there are factors which can affect you. So you can see a child who has a mental disorder. But if you look backwards, you see there was a problem before birth. So, and that's why we tell mothers when they are pregnant, they must go for the clinic. It's not just a question of going, it's to make sure they are screened, and diseases like torches. Torches is an acronym of diseases that can move from mother to the child. TO is toxoplasmosis, R is rubella, and that's why you get this immunization. C is cytomegalic inclusion virus, H is herpes, S is syphilis, and other viruses. This can enter through the placenta and affect the child and cause mental disorder. Or during the birth, the perinatal area is when you are giving birth. A lot of mothers, especially with a constricted pelvis, the child is not able to come out, or there's a problem. Then there's asphyxia. Asphyxia is the lack of oxygen. That oxygen affects the brain. The child might come out, but later on in life, that child may develop mental disorder or even epilepsy. Or postnatal is after delivery. Okay? This diagram, maybe you cannot see it, but then it shows you how central the brain is, how it is affected by the factors you have mentioned, the prenatal, perinatal, postnatal, and trauma to the brain. What can traumatize the brain, including irradiation and so on, or drugs. And that's why we tell mothers when they are pregnant, the first 3 months of pregnancy, they should not take any drugs. Sometimes those drugs, they will affect that child's development. In the 60s, mothers took a drug for family planning. When these Catholics make noise about the drugs and family planning, sometimes they know one thing or two. People are given a drug called thalidomide, and the children that came out of that, they didn't have hands, they didn't have legs. It's called amelia. Or during the Chernobyl nuclear disruption, that irradiation affected young ladies, and they gave birth to children who were affected. So what we're trying to say is that your environment affects the brain. That trauma can also be physical, maybe a road traffic accident, you are hit on the head, there's bleeding, or you had hypertension, and then there's bleeding inside the brain. All right? These are external factors which affect the brain and eventually may give rise to a mental disorder. But also, the next slide, the next one shows that we can have an internal environment. In other words, you have seen that some people, there are some mental disorders which they seem to be more in certain families. You can see a family with almost everybody is sick. Those are genetic, okay? Also, when there is change in your life, age, as you grow old, you have changes in your brain and all your gender. If you are a woman and give birth, sometimes they develop mental disorders, including depression and psychosis, something we call psychosis. Or during menopause, again, changes in hormones and so on. All right? The next slide talks about something we call the limbic system. Now, all these factors are coordinated within what I told you, the thalamus and the hypothalamus and the other nuclei that are in that center of the brain. And therefore, When there's an imbalance of these neurotransmitters, as I said, one will present with physical disorders. And these disorders will affect all the systems of the body. For example, the genital, that GUS you see there is the genital urinary system. For men, they may have a sexual problem, sexual dysfunction, erectile dysfunction. Somebody comes and says, nowadays I can't erect because there is a problem, and the problem was the depression which has affected your sexual activity. It can be a GIT, it can be your mood, cardiovascular system, blood pressure can rise, or fatigue, or stupor. These patients and aches all over the body. This is what we have called Hapa syndrome. These are patients who come to the doctor with a very funny complaints which you do not yet have not finished, which do not answer to any known pathophysiology. So they have a headache here, and then they tell you it moves to the neck, then it comes down here, and then it comes back here, and then it moves. And then they'd have a tendency of going from doctor to doctor shopping. Those are part of the conditions that you may have. The underlying condition is depression, but somebody does not know. Sleep, you may have insomnia. Poor sleep, you have difficulties in going to sleep. What we call, you can have initial insomnia, or mid-term, or terminal insomnia. You wake up, you sleep, you wake up at 1 o'clock, and then you can't sleep again. Now, let's go to the next slide. I'm trying to be very fast. All these are coordinated through a system we call the circadian rhythm. Now, those neurotransmitters malfunctioning, they are going to affect your circadian rhythm or diurnal rhythm. Now, all animals and even plants, we seem to live in a certain, specified rhythm, okay? And this is the same rhythm that affects our climate. Our climate is in rhythm. There is a rhythm, okay? Which is now time for rain, for whatever, which of course now has been affected because we have destroyed our environment. Now, as an individual, your body has a clock inside the area I told you, and that clock is the one which controls you. It's the one which wakes you up in the morning. It tells you go to sleep, go to eat, and when you eat, it tells you have had enough, now stop. It gives you motivation, gives you reason to live, okay? And at night, it tells you now to go to sleep and wake up. If you are a lady, it's the same system that affects your menstrual cycle. So if it is disturbed, even your menses will be disturbed. Now you can see if you have a mental problem and you have menses disturbed, you end up with a gynecologist. But really the problem is psychological. Now that diagram, let's go to the next slide. Next slide is basically saying what we have discussed about a rhythm, about how and why there are changes when there's a disruption of the neurotransmitters. Some people will become, they lose appetite, they become anorexic. Others may eat more. They may become bulimic. They can suffer from bulimia. Bulimia is eating a lot, and they end up being very fat, and they don't know what is happening. Others have become very thin, suffering from a condition we call nervosa. Okay? Alafu, let's go quickly to the next slide. Now, here I'm mentioning something called neurosis. There is neurosis and psychosis. Neurosis are common, and they affect about 3% of the population. And symptoms of anxiety include feeling of fearful, anticipation, irritability, sensitivity to noise. When a door is closed, you want to jump. Poor concentration, therefore your performance comes down. All right? You can have a simple neurosis like simple phobia, agoraphobia. Let's go to the next slide. Simple phobia, generally, they are exaggerated versions of common fear. For instance, fear of heights. Like me, I fear heights, you know. You go there, you feel like you are dizzy. Agoraphobia of open spaces, or social phobia. This is a person who will have a problem interacting with others. There is also an element called hysteria. You have heard about hysteria. It's a neurosis. It's a person reacted to stress. And therefore, because there is a lot of stress in that environment, for example, schools, there may be a teacher who is disturbing, and then the child becomes hysteric, and that hysteria can also can affect the whole school. Then you have what we call mass hysteria. When you treat this, you must find out who is the cause of that. What is the problem? Okay? There's compensation neurosis, the next one. These are people who develop neurosis because they got an accident and they were not compensated, they become sick. This is common. In fact, like people, like I have one patient is an army. He was in army, American army, and then he got what we call post-traumatic stress syndrome, because when he went back, he was not compensated, so he's feeling very sick. In America, this is a big thing, and they take care of their patients like that. Obsessive-compulsive neurosis is a situation where you have repetitive activity, like closing the door, okay? You have had this problem yourself sometime. You close the door, you go out, and then you are not sure whether you closed. You come back and check whether it is closed, and then you go, and then you come back. If it is very serious, you cannot go anywhere else because you keep on checking. Or washing hands. Like now, the thing we are having now is developing almost into a neurosis. We are washing hands all the time. Or doctors washing hands because of doing surgery. These are compulsive neuroses. Let's go to quickly, nafikiri about 10 minutes. Mood disorders or major, these are major. What we have been mentioning, those are minor conditions. The important thing is that those minor conditions, one may not know they have them. But if your circadian rhythm has changed, the pattern of your life changes, probably you have a stressful situation, maybe you have depression coming in or anxiety coming in. But when it is severe, then your mood changes completely, you feel sad, and you lose hope and become suicidal. You've been not only suicidal, but you can even commit suicide. You have been told in the last 1 year, I think there were 400 suicides reported in Kenya. Now these are people who are living normally, but they are under stress, and they don't know what to do, and they go and commit suicide or attempt suicide. So there's major depressive disorders, dysthymic disorders, or bipolar. Okay? When we talk of psychosis, is that there is abnormal thinking and perception. These are the people now you call mad, okay? So that's why many people, when they are referred to as psychiatrists, they say, I don't need to go because I'm not mad, which is true. But you may be having a neurosis, all right? In psychosis, you have abnormal perception. You start having delusions. Delusions is a situation where you have abnormal thoughts or beliefs which are not shared by the community where you are coming from. For example, you can say you are a king or you are queen, somebody, and we know you are not a queen, and you believe you are. Or you believe you are being hunted, you are paranoid. People are attacking you. Hallucinations is where you have perception without stimulation, all right? You start seeing things or start seeing people and they are not there. That is hallucination. Those, if you have hallucination, delusion, then you are probably having a major psychosis, all right? The cause can be functional. Functional meaning we don't know why you have it, or it could be, like we said, genetic, or it can be, there could be a cause. For example, if you have any other condition like malaria, even dengue fever, even COVID, it goes to the brain, you can also present with a psychotic disorder. Or it can be drug-induced. There is also mania. Mania is when somebody is very aggressive. These are the people now we actually call mad, manic. They can beat you up, they can do anything to you. If you are near here, I could have shown you some teeth. Hapa ni kuumwa niliumwa. But somebody was psychotic. He can actually eat you up. Drug-induced psychosis, people who are taking drugs, cannabis, and so on. In schizophrenia, these patients, again, these are the typical now mad people, all right? Who have, whose personality also changes, disintegrates, and you can see them walking around. All these people can be treated. All right, the next slide talks about work performance, just to say that if you have under those stress, then you cannot work well. If you are a student, you cannot perform. And what happens is the teachers think you are lazy and they punish you, yet you are already punished. I have a patient right now who wanted to end her life because the teachers are insisting that she must do ABCD, yet she has a depressive disorder. Parents also can discipline their children when the children actually have emotional disorders. The emotional disorders can also affect children, even small babies, even big babies, depending on the environment, how hostile it is. All right? Drug and alcohol induced, we have mentioned that already in addiction. There is preoccupation with the behavior, temporal association, loss of control. Let's go to the next one. These are the various drugs, alcohol. Unfortunately, alcohol is so perverse, it's almost everywhere. But we have a lot of patients now who have developed psychosis because of alcohol, cocaine, morphine, and these are now being taken even in schools. Children who are not doing well because they're under stress, they end up getting into the wrong company, take these drugs. Cannabis, cat, and unfortunately cat, mugoka, and miraa. It's even funded by the government, Kenya government. They are giving them billions to grow. But we have seen them affecting people's minds. Now, in summary, how would you approach this? Let's go to the next slide. This one, we teach people about repentance. The first need there is repentance. Appreciate, you must learn to, repentance is just saying, I'm sorry, mambo inaisha, so that you don't hold anything in your mind. Learn to appreciate others. It's good you have appreciated these doctors. They will feel good. You know, they have been appreciated. Usimdharau, kama Africa, they don't like appreciating people. Europeans, they are very good. If you dress well, they say, hey, you look nice, you look beautiful. Ukimwambia Mwafrika atakwambia why. Kwani umeona nini? You know, but it's good. Even your children appreciate your pastor, appreciate your pastor. Appreciate everybody. It is good for you and it's good for the person. When you appreciate and that person is happy, there are some hormones which you call the endorphins in you that make you happy. It's like giving. This giving you are giving. When you give, it also helps you. It helps your life rather than having everything by yourself. Love, have friends, dance, I've already mentioned. Singing, I should not talk about singing because I found you singing very well here. Mnaona mothers, you know, naimba kabisa. That is great. Choir, pia mnaimba vizuri. Mnaimba vizuri basi. I've been missing you anyway. Applause. If you get you'll get applause like you have applauded. Europeans, they applause everything. I don't know whether you have noticed. They make you feel great. Even if you are down, you come up. Learn to plan your life, your day, your money. Learn to say yes or no. Si ukipewa pombe lazima useme yes. Say no, thank you, I don't take. And it is very difficult, especially if you are a senior person. Na umepewa hapo, like, and unaambia mzee kunywa hii, nasema no, thank you. Many people are going into that trap because they cannot say no. They fear. Diet. Diet is very important. We are now teaching, I'm personally teaching people to go back to traditional diet. That diet was good. It had a lot of nutrients. Now what we have done now, we have come to eat junk. Vitu kama chips, those are junk. Vitu kama nini, sausages, zile tamu zote. They are bad for your health. You are okay if you are young, but it will catch up with you when you are much older. Okay? Learn to forget, learn to breathe, massage, be grateful, don't exaggerate, exercise. Let us, all of us, let us start running and so on. Now, in management, apart from that aspect of management, there is drugs. There are drugs, but drugs is given if necessary. Most of the management is for you to change the environment. Just make the environment friendly. Kama ni watoto, make it friendly. Sometimes we leave those watoto tumewachia wale nuns. They harass them. Those children feel like they are living in hell. So you have to change that environment at the school, at the workplace, and so on. If that one does not work, then you may have antidepressants or antipsychotics. And as I mentioned earlier, these drugs are given to basically increase the level of the neurotransmitters. So if they are low, you are given, and you start feeling well, and later on, you may stop them, but gradually. Other people may have to continue taking drugs for a long time. Now, nafikiri hapo imefika hapo. There is the other slide. Uko nayo? Yeah. Now this is a product called Bemehu Herbal Infusion. Sawa? Umeiona hapo nje? This is manufactured by Dr. Mwinga. And it's made up of spices. And it's because I came up with this after this condition which I developed. okay? And when they came to pick me in the house, they found a lot of juice, nyingi huko sana. Fridge ilikuwa imejaa, full of sugar. Sasa all those things were removed, and sijagusa tena hiyo for about a year sasa. When I see soda, carbonated drinks, you feel sick. Those are dangerous things that we are taking, and this herb is made up of spices, which if you take, they improve your, this particular one has what? Ikona nini? Ikona ginger, nutmeg, ginger, nutmeg, cinnamon, na mkombero. Nani anajua mkombero hapa? Kama unatoka Western unajua. Okay, it is good for wazee ambao sasa wanaanza kupata shida kidogo. The other one. Let's go to the other one. This one, herbal infusion, again, you can see it is just the normal spices which we have. So it's not something that ya kiuganga. Kuna uganga, these are drugs. These are foods. This one we call Bemehu herbal infusion is recommended for drinking. Unachemsha, unakunywa, ukitumia hii una haja ya chai, but if you want, you can also add the tea, and you get a lot of vitamins. A lot of it. Those are the constituencies there. You have black pepper, you have turmeric, cinnamon. Msijali kwa nitawapatia mmoja mtengeze chai ya free, eh? How you want it two? Maybe two. You are too many. Yeah. There is also samples outside there. You are not selling, but if you want for yourself, you can buy, like you can also drink. Now this is the other slide. Next one. Next one. Next one. How kuweka? You have another one? Another one? Do you have another one? Yes. That is general information. That is what we have been discussing about your diet. On the right, there are foods which the foods which we discourage you, and you better stop. If you are over 40 years, if you are under 40, maybe it doesn't matter. Lakini kama uko over 40 kama mimi, you know I'm 45. So, all right, avoid red meat, avoid sugar, kutumia asali if necessary, or no sugar, salt, punguza because of pressure and so on. You can read there. Alcohol, avoid alcohol, drugs, kama unatumia processed meat. Hizi ni vitu kama sausages, bacon, ile chakula tamu tamu ambayo imewekwa a lot of salt, it has been preserved, is poison to you. Waendelea kutumia. Smartphone is a complication of the neck. For looking at the smartphone for too long, or computer, you can get changes in the neck, giving you anxiety and pain. Computer position, okay? Maintain direct. White rice, avoid. Take brown if necessary. Brown is good, by the way. Carbonated drinks like soda and energy drinks. And that's why I came up with this. These are energy drink, which is natural. Unless what you are taking as energy drink with a lot of poison, a lot of salt, a lot of sugar, so much sugar, that it can stimulate depression. So what do we recommend? Pumpkin, onions, watermelon, nuts, all types of nuts, tomatoes, sweet potatoes, greens juice. You can make juice from greens, cereals. Yani ile chakula ya kienyeji tu ya nyumbani, kumbe ndio chakula nzuri. Bone soup, githeri, cassava, peas, brown rice. Mnakula hii Mnakula. Na ikipikwa nyumbani watoto wanakataa. Now you have to teach them. that is not that is the proper food, and what we are giving them, you are making them obese. You have small children who have fat. It is bad, even others. This product also, the Bemehu Plus, Bemehu itself, is a tenderizer. Kichukua nyama, weka kijiko uchemshe, hiyo nyama inakuwa soft. So it has multiple effects. Wacha nisimame hapo because you cannot address everything. Unless there is a question. Is there any burning question? Any? Au umeelewa kila kitu? Yeah, the kitabu, yes. You are good. There is a book there by Dr. Mwinga. In fact, all this I've talked about is in that book, and we have that book outside there. It is costing 2,000, but there's a special offer of 1,000. Right now, people are going more into mental health. And this country needs more mental health than ever before. Okay, call it mental, come spiritual health. Because people are looking for money, they are doing anything, and things are bad. Umeona vile watu wanapigana marisasi, rich people, they are killing one another. So the issue of mental health right now has become an emergency. And I must congratulate this church for asking me to talk about mental health. I know it's maybe nimewachokesha. Oh yeah, that slide, that's the showstopper. There's no health without mental health. So there's a book you can buy. We are giving at a special rate of 1,000 instead of 2,000. There are those products. Products also, I think itawapunguzia ni 700. Can they make them pesa ngapi? Tupunguze iwe ngapi kazungu? We wacha. Tantia Sara. Okay, we can make it 500 for the church. 500, lakini yenu ni mtapewa bure. Any other comment, question? Does it clear about mental health? What is mental health? And the pastor here alizungumza vizuri about your mind, renewal of your mind. So apply those principles to make a difference. Asante.
Asante sana daktari. Hayo makofi yanatosha kweli? Tumpigie makofi mazuri zaidi.